Howdy. It is Friday, the 17th of April. So I know I have not been posting anything at all for quite a few days. It's been a bit of a tough week this week. I think the fact of isolation has been a little bit difficult. So more than difficult, I've been feeling it more this week, let's say that. So that said, I am going to get straight into the article I would like to discuss, which is an article from The Independent, and it's titled "At least 300,000 people likely to die from coronavirus in Africa this year. In best case scenario, UN report warns." So at least 300,000 people in Africa are likely to die from coronavirus, even in a best case scenario, and 29 million people could be pushed into extreme poverty, the UN Economic Commission for Africa has warned. Although Africa has reported fewer than 20,000 coronavirus cases thus far, the World Health Organization has warned the continent could see as many as 10 million cases in 3 to 6 months, a number which would severely overwhelm health services. Now, to protect and build towards our shared prosperity, at least 80 billion, is needed to immediately resource a health and social safety net response, a report by UNECA said. The agency found that in the total absence of interventions to slow the spread of the virus, more than 1.2 billion Africans would be infected and 3.3 million people would die this year. Most African governments have already introduced some social distancing measures, ranging from curfews, travel guidelines in some countries, to full lockdowns in others. Even in the best case scenario, in which governments introduce strict social distancing, once a threshold of 0.2 deaths per 100,000 people per week is reached, Africa will still see 123 million infections, 2.3 million hospitalizations, and 300,000 deaths from COVID-19. Efforts to control the virus, which has already put major strain on well-funded healthcare systems in Europe, will be complicated because 36% of Africans have no access to household washing facilities. The continent has just 1.8 hospital beds per 1,000 people, compared with 5.98 beds per 1,000 people in France. Although Africa's young demographic could provide some relief, as COVID-19 has been found to be less severe for young people in general, many people in the continent are also vulnerable to disease due to HIV, AIDS, tuberculosis, and malnutrition. In addition, 59% of the urban population is concentrated in overcrowded slums where the virus could spread easily. The report added that Africa imports 94% of its pharmaceuticals, and at least 71 countries have banned or limited exports of certain supplies deemed essential during the pandemic. Africa is unlikely to be able to produce that level of funding, as the continent's economy could shrink by up to 2.6% due to the pandemic. We estimate that between 5 million and 29 million people will be pushed below the extreme poverty line of $1.90 per day owing to the impact of COVID-19. Nigeria alone could lose between $14 billion and $19.2 billion in revenues from oil exports this year, while the prices of other African commodities exports have plummeted as well. Lockdowns in Europe and the US will also affect Africa by threatening $15 billion in annual textile and apparel exports, as well as damaging in its tourism sector, which accounts for 8.5% of Africa's GDP. So, as I was dwelling in a bit of a self-pity mode of how awful self-isolation feels, reading this article, and why I chose to pick this article and bring it to your attention, is because of the fact that